My name's Richard Price. I'm an IT manager and I work for Yorkshire Ambulance Service. My role is as an IT manager, so it's not a traditional role that would be involved with public health or making every contact count. So I'm really interested in how the technology can be used to enhance that framework. What we've been involved with from the start has been developing a tool, a self-assessment tool, so it's looking at the technology and how we can maybe influence that, and also looking at how e-learning and all the other online world and Web 2.0 can be brought into this new framework. I think the future is here with mobile applications, with e-learning, with different types of simulation and other types of learning coming in. It's all about bringing this together, and it's a more integrated, more joined up world that we're coming into now. With e-learning, we have quite a high number of users because we're so spread out in terms of the geography, especially with Yorkshire. We're spread out over 5,000 square miles. We've got 80 different sites, so there are opportunities there to engage with people that may never ever come into a contact with somebody in a classroom once they've started their career. So with getting people involved with e-learning, they can do that at their leisure, at a time that suits them, and it's a really exciting opportunity for us to engage with groups that we wouldn't necessarily have contact with on a day-to-day basis normally. So I think this is a really exciting time for us in terms of what we can do. It's not just about us taking somebody, picking them up on the side of the road and taking them to hospital. We run a range of services, so patient transport, for instance, taking people to their hospitals. Our crews are going into people's houses every single day, thousands of people. A crew goes in to somebody's house, they spot maybe a piece of loose carpet on the floor. There's a potential for that individual to trip over, so they will contact social services. Somebody from social services will come out to fix the carpet. The person fixing the carpet might spot there's no smoke alarm, so he contacts the fire service. Fire service come out to fit a smoke detector and say, well, do you know how you can reduce your risk even further of having a fire? Stop smoking. Stop smoking in bed. So it's an opportunity for all these different agencies that perhaps in the past have worked disparately to come together and actually start working together. And it's not just about public health, it's about the wider agenda of all these different things that could come together. I think we've focused primarily on our key staff, our core staff, and how we deliver perhaps statutory and mandatory training. So this is how you hold a fire extinguisher, that kind of thing. We've got an opportunity now to look at how their relationships with patients build up, and how we do work with other agencies, and e-learning is a vehicle for that. Certainly within the ambulance service, looking at that role, we're still very, very early days with that. We have an exciting opportunity there, and I think everybody recognises that, but how that's going to manifest itself, I think it's very early days. So from the ambulance service point of view, in 18 months' time, I would like this to be embedded within our staff so that they do go to people's houses, and to take the carpet tripping up example, reducing the attendances at a falls clinic, for instance. Our crews will be trained to spot that kind of thing, not just transporting a patient from A to B as we've historically done. With the wider MECC agenda, we're developing a tool, the Making Every Contact Count assessment tool. We're developing websites, we're developing e-learning products, and it's about bringing all those together into one place that's easily accessible and making that approachable and engaging for people that actually are working in public health and the wider agenda.